And this patient asked,
Okay.
what exactly is triple negative breast cancer and how does it differ from other types of breast cancer?
Super question. So, if you imagine a decade or two ago, the simplest way that we had to define breast cancer was really just based on its hormonal drive. And the majority of breast cancers are driven by estrogen and progesterone. We later recognized another important biologic driver, which was the protein HER2. And so, when patients had tumors that tested negative for hormone receptors and negative for HER2, doctors simply called that triple negative breast cancer because they were ER/PR negative and HER2 negative. And I think a big limitation of that terminology is that it never really described what was unique about the breast cancer. It just told you what it wasn't, that we knew endocrine therapies, anti-estrogen therapies would not be of benefit. We knew that the therapies developed for HER2 positive breast cancer, as it was defined back then, really wouldn't be of benefit. And so triple negative breast cancer just simply means hormone receptor negative, HER2 negative. But we really need to do a better job at describing what's the subtype of the triple negative breast cancer? What are some of the important biomarkers? Because that describes the biology. And then that will help you and your doctors understand what the best treatments are.
Okay, thank you. That's really helpful.
Sure.
Um, okay, this is a good one. I think I have felt this deeply. Just in understanding our prognosis. And so this patient asked, what are the current statistics on the prognosis for TNBC? My oncologist said that most of the statistics I can find online are outdated and that my prognosis is probably much better than this. Do you agree? So I
It's a
know you.
wonderful question.
Yeah.
Yes, right. It's a wonderful question. And I think I would take a huge step back at a way to address that and say the internet is a great place with a lot of information, but sometimes it's challenging to put the information that you find there into context and to understand how much does that really apply to my own individual situation. So I would just couch what you do find out there really needs some professional guidance to help put that into context. Early stage triple negative breast cancer, whether you hear your cancer is stage 1, 2, or 3, is curable breast cancer. The goal of therapy there is that with surgery, with chemotherapy, with immunotherapy, if that applies, with potentially radiation, with all of that together, we hope to keep that breast cancer away for life and minimize any risk of recurrence and cure women of breast cancer. The risk of recurrence varies depending on a bunch of different things, size of tumor, lymph nodes involved. But I will say that compared to what you'll find in the literature from 5 years ago, 10 years ago, we now have such improved therapeutics, a strategy for immunotherapy, strategy for neoadjuvant therapy, where you get your chemo and your immunotherapy before surgery. All of that has enabled us to improve overall survival. So if you Google for stage 2 triple negative breast cancer, what you find with long-term follow-up is not going to reflect our most current hot off the presses therapies. And similarly with metastatic breast cancer, there, unfortunately, with our therapies today, we can't say that we can make the cancer go away forever, but we have done such a better job. And I see innovations month over month and year over year that has improved the ability for women to live longer with high quality of life, with controlling the breast cancer while it's managed with new innovative therapies. And so I think these are really frank, honest conversations to have with your doctor, your care team, to really ask what is the goal and expectation of the treatment that you're recommending, right? And really be sure you're talking about what your values and priorities are with your care team so that your treatment plan can really be very personalized for what's most important to you.
Thank you for that. I mean, that is really encouraging, and it sounds like more than ever before, there are so many tools in the toolbox, as they say, to help with this type of cancer. Okay, so you touched a little bit about the specifics of everyone's disease. This question is, how does the grade of TNBC affect its aggressiveness and my treatment options? Is TNBC always grade 3?
I love this question because it really gets at what I mentioned in the very beginning, that triple negative breast cancer is very heterogeneous. It's not just one disease. So just a moment on grading. Tumor grading is on a scale of 1 to 3. And I would think about it as a spectrum that allows the pathologist to tell us how closely does this cancer cell look like the normal breast cell of origin, right? The closest that cancer cell looks to a normal, well-behaved breast cell, that would be more like a grade 1 cancer. And grade 3 cancers, or poorly differentiated cancers, have really learned how to misbehave, right? They don't really resemble the pure original breast cancer cell or the breast cell that they derived from. So I would say that the majority of invasive breast cancers that we see end up being grade 3 cancers. And the majority of triple negative breast cancers have that poor differentiation, but not all of them. And there are some unique subtypes of triple negative breast cancer that can have grade 2, grade 1 biology, may come up as moderately differentiated on a path report. You may see terminology in the path report that calls this an adenocystic carcinoma, right? So those test ER, PR, and HER2 negative, they would test as triple negative, and yet their biology is very indolent, very quiet, and grade 2. So this is the nuance that you really do want to look at all of that language in the pathology report, and don't be shy about asking your doctors what's the significance of that. Yet if you're seeing grade 3, know that that is the most typical grading that we'll find with an invasive cancer and a triple negative breast cancer.